Hey there, Margaret. Can you hear us? We show you on the call, but you're muted. There you go. Now we see you. All right, we're good. We can see you, and you can see us. I think, right? Or you can only see the thing that says that the meeting will start at 5:30, huh? Let me go show you the room real quick.
Oh, Margaret, not actually not yet for the closed session. That'll be when that
All right, good evening, everyone. It is 5:30 on the dot, and we are going to call this meeting to order 1.1. I do want to acknowledge that almost all of our board members are here. We do have one en route, but I do want to let everyone know that Dr. Hill will be joining us virtually. All right, so now let us move to 1.3, approval. Oh, I'm sorry, I went too fast. 1.2, the pledge. And we're going to ask Vice President Wyatt if he would lead us in the pledge.
Ready, folks, place your right hand over your heart. Ready, begin. Pledge allegiance to the flag.
Thank you, Vice President Wyatt. And now we are at 1.4, our inspirational message, and it is coming tonight from Mrs. Abigail Rosales Medina.
Thank you.
Oh, I'm sorry, approval of, I'm telling you, I'm back in virtual world. Ms. Rosales Medina, I'm going to get you in a second. Oh, you are, okay. So we're going to, 1.3, approval of the agenda. Okay, we're pulling an item. He's going to tell me what it is right now.
Hold on.
All right.
Okay, we're going to be pulling item
Don't vote yet.
10.3.
10.3, he said it
We're
is.
pulling that item. I need to do some. Pull that item for now.
Okay, 10.3 is being pulled for a little bit more research. Did you get that, Ms. Cunningham? Oh, okay. All right, and I believe our approval to cast our vote is in front of us. And Dr. Hill, and we can hear her through. Dr. Hill, could you cast your vote verbally for us? Thank you. We just saw you on the screen as well.
Madam President,
Yes.
can I say something to Dr. Hill?
She went away, but Dr. Hill, you can hear us, I'm sure. And
Dr. Hill, we're glad that you're feeling better, and we wish you and send you prayers to get even better. Okay, good. We love you.
All right, we look forward. Thank you. And I see that the motion was carried. It was on the screen. I did see that. All right, Mrs. Rosales Medina, we are ready for your inspiration.
Thank you so much.
1.4.
And so first of all, it'll be really quick because I know that we have an agenda full of different items. So my inspiration, because I just left for kind of like a coast road trip, camping and so forth. It was from Pismo Beach all the way up to San Francisco on the one freeway, the one highway. And the thing with, you kind of reflect on what your priorities are. And I think I just want to, my inspirational message would be more on our responsibility as a school board, as well as the district and the students themselves and our staff, on creating what's the bigger picture for our future for within the school district and, of course, the education piece. So I'm just really excited to kind of note that how we communicate, how we interact, how we respect, and how we move forward is going to be key for the next school year. And so it's just keeping that in mind. I think when you escape for a bit, you kind of ponder and reflect the things that are really important. And for us, education with our kids, making sure that everyone is able to receive that high-quality education. And it's also about the communication of how we interact, how we speak to our parents, how we speak to our students, that can determine if we're going to have a good environment or we're going to have a bad environment. Sometimes it's also how the way we say things, the way we interact with each other can make a huge difference. And so I'm just looking at how we can also use that as a great way to continuing improving our district is by that positive communication and really collaboration and so forth. So that's my little piece. Thank you.
Thank you, Mrs. Rosales Medina. And yes, we are now going to move to 2.1, closed session public comments first. Did you say, Ms. Cunningham, you have some?
There are no comments for a closed session.
There are no comments. All right, and Mrs. Ceballos is here, so just for the record, we know that you were on your way. Okay, 2.2, we're now going to adjourn to closed session, and so we will be back shortly, hopefully, but we will see you. All right, board, let's adjourn. All right, hello, everyone, and thank you so much. Sorry for the delay, but we are going to now return from our closed session, and we won't be reporting out, or we will, let me see. Oh, I do. All right. So we are now at 3.1, appointment for director and elementary instruction. Be it resolved that the Board of Education approve the appointment of the following employee. Amy Coker, Director, Elementary Instruction, effective date, work year, and salary to be determined.
So moved.
Second.
It's been moved in second. Let us go ahead and, there's no further discussion, take the vote. Uh-oh, you're ahead of us, but okay, we got you. All right, it is on our screen. Let's vote. All right, it's there, and Dr. Wyatt will be returning shortly. I believe she is here in the room. Would you just stand and wave to us? Hello, congratulations. Congratulations to you, Ms. Coker. Looking forward to your continuous wonderful work. All right, we are now moving to 3.2, petition to expunge, rescind, or modify youth court or expulsion.
So moved.
Second.
It's been moved and second. Is there any discussion? If not, we will prepare to vote. Is? Thank you, Dr. Hill. All right, unanimous vote. Motion is carried. Thank you. We are now moving to 4.1 public comments. And again, sorry, we're a little delayed tonight. And I have a public comment here. Oh, this is exciting. The name is Terry Washington. We are going to ask you to come forward to the mic, and anyone else that's coming with you. You all, I recognize this is a celebrity in the house, but I will go ahead and let him share, or they share with you during this public comment. Welcome.
How you guys doing today?
Good.
Can you
Go ahead and
speak
speak loud.
louder? Can you speak louder? Yeah.
I said, how you guys doing today?
We're doing good. Thank you. Very well.
Well, for the ones that don't know, well, my name is Terry Washington. Been going to school here in San Bernardino for a very long time. Almost finished, and I train at over here at Project Fighting Chance, and I just got back from Lubbock, Texas, competing at the 2021 Summer Festival Junior Olympics, and I won gold. So I was. And I'm here to say thank you to San Bernardino City Unified School District for allowing me to just thank you for the support, thank you for everything, and appreciate you guys.
We are so glad to have you here. And what school are you representing as well?
I was going to Pacific, but now I'm at Sierra High School.
Excellent, excellent. Well, I will say, some of us, did you hear him? Sierra? And I will say that some of us had the opportunity to witness your creative work in the ring. And we're so proud of you. We're just so proud. Is there any, Mr. Tillman?
Are you formerly known as Terrible Terry?
Yeah.
Yeah, you've been there since the beginning.
I've watched you for a long time. I'm proud of you. Congratulations.
Thank you.
Excellent. Dr. Wyatt?
Oh, absolutely. Congratulations, Terry. And, thank you to Madam President, Dr. Rogers. She got me the link just in time. And so I watched your match as well. And I'll be honest with you, you had a big opponent in there.
Yeah, he was
Big
real
opponent, and he was fighting a little dirty too. You know, I like the pugilistic
I
as
had
well.
to get my rematch back because he beat me before.
I saw that, you know, but you composed yourself well and you hung in there and fought a smart fight. And again, great job against a bigger opponent and one who was, you know, fighting a little bit dirty. So, you know, you represented San Bernardino very well, and we're very proud of you.
Thank you.
So thank you again for representing and putting San Bernardino City Unified School District on the map. We applaud you.
Thank you.
Uh-oh, I think Dr. Hill. Dr. Hill, come. Go.
Thank you.
Thank you for coming. Good to see you, Mr. Boykins. All right. My next public comment, I believe, is via Zoom. Are we prepared? Okay.
Okay,
Wanna
our next
announce-
comment is from Valerie Leonardi. If you're available, please unmute.
Yes, we can hear you. Thank you. And our next public comment is a call-in. No?
That's all our
That
calls.
is it? Okay. All right. Thank you. And we will now move. I was texting communications on that. I believe our community room is muted. So they need to hear. Okay, 5.1, accept and approve the memorandum of understanding 2021-2022 classified work year calendars between the San Bernardino City Unified School District and California School Employees Association, Chapter 183. I am now opening up the public hearings. Are there?
There were no
No?
comments.
All right, so I will close the public hearing. Be it resolved that the Board of Education accepts the memorandum of understanding of the 2020-2021 classified work year calendars between the San Bernardino City Unified School District and California School Employees Association, Chapter 183.
So moved.
Second.
It's been moved and second. If there's no further discussion, then we will go ahead and take the vote. Thank you. All right, thank you. Motion carried. We're now moving to 6.0, reports and comments by union organization. And first up is 6.1, San Bernardino Teachers Association. Is there a representative here tonight? Oh, hello. Yes, we can hear you. Thank you. 6.2, California School Employees Association. Is there a representative? Yes, we can. Thank you. And I just want to announce to the viewing audience, we know that we're having some technical difficulties with hearing the comments, but IT is aware and have been alerted to make those corrections.
Madam President, are they going to fix it?
That is what I'm,
It's YouTube, I think, yeah.
okay, 6.3, Communication Workers of America. Is there a representative? All right, if there is not, we'll move to 6.4, San Bernardino School Police Officers Association. Is there a representative tonight? 7.0, Reports and Presentations. 7.1, Energy Program Update. Who am I turning it over to? All right. Hello, Mr. Precy.
Evening, Board President Dr. Rogers,
Hello.
Superintendent Dr. Irvin, Cabinet, and members of the board. Tonight we're going to be discussing our energy conservation program, and I'm joined here today with Robert Etchemendy. He's our Client Services Manager with Synergistics, and we're very excited about giving you some information this evening regarding our energy management program. Go to the next slide, please. As some of you may know, the school district has had a partnership with Synergistic for close to 10 years, and over that period of time, we've saved close to $42 million in cost avoidance, which is an amazing number, with a 62% reduction in energy use and an overall 31% savings to our program.
Good evening. Next slide, please. But as you can see, the environmental impact before you, we can showcase 4 different areas. I'd like to specifically point out these are very fantastic accomplishment, 46 Energy Star certified buildings. Below that, you can take a look at 17,105 greenhouse gas emission tons of waste recycled, and obviously we have some other fantastic environmental impact overall.
Next slide, please. All right, so this slide here is actually very, very exciting for us because when Energy Star raised its requirements to receive accreditation and certification for the Energy Star back in 2019, it was much more difficult for buildings to receive this certification. And our San Bernardino School District has just done an amazing job, and you'll see the listing of the school sites up there, but 46 of our school sites, our facilities, got certification through this program. And you can see we had the most school sites than any other school district within the state of California. And I mean, that's amazing. If you think about some of those school districts that are just so much larger than ours, we were number 1 and number 4 in the nation. So just wanted to say hats off to the board for giving us the ability to do this, the cabinet for supporting, and also with Synergistic.
Abigail, I'm taking.
Yes,
Yes.
just really quickly, if you can introduce Synergistics, just to give an overview, because I know that it was just a name, what you do, just briefly what you do within the school district and so forth, and that way I can have more of a picture.
Certainly. We partner with public entities, school districts, municipalities to conserve typically on the major commodities that you use. For example, here, natural gas, electricity being the highest, most used, and then of course water, which encompasses domestic and irrigation. So domestic water, all the water that's being used inside the facilities by students, teachers, staff, and then of course irrigation, which we have quite a bit of as well. So we help streamline and use what we need, but not, we try and curb any waste that may be there.
When you refer to electricity, is that the carports or is that something different? Just to clarify. That's something different.
Different.
Okay, thank you.
Dr. Flores, and there are some
I
more
wanna
slides, just so the board knows.
Okay, I want to commend you. And so my next question is, so what do we need to do to get the rest of our schools up there?
It's definitely going to be a work in progress. We have a lot of initiatives that we're moving forward with. We're looking at some pretty interesting stuff. We're working with electrical engineers, electrical contractors, and we actually are piloting a new program at a couple of our school sites. And it's going to be interesting to see because I think our next charge is going to be focusing on some of those demand charges that we get from SCE, which comprise about 35 to 40% of our utility bill. So we're going to be tackling from an engineering side ways of reducing that.
Okay, and who's number 1, number 2, and number 3 in the nation?
Oh, that's a good question. I'll have to get to that. I didn't see
Oh,
that.
you don't have that? Okay. I know we're number 4, but I want to know who's number 1 and number 2 and number 3, so we can beat them or be on par with them. Thank you.
Next slide, please.
Okay, here we'd like to take a look at the increase in overall commodity rates. And despite that increase, had we not implemented a partnership that you as a cabinet and board, superintendent have allowed us to work with you and our support staff here, our energy specialists, we would have spent over $1.6 million since that base year level. So you can see here on these two slides, or this slide right here, water, of course, has gone up, electricity has gone up, but despite those costs, we have still found with our partnership to save money. Sorry. Next slide, please. Okay, so here we're going to see the red line. If you can see on the bottom, it has a legend, the base year, which is our year that we're basing our findings off of pre-COVID, which is that middle kind of blue line. And then, of course, a COVID time frame. So we can see where the district was. Over here on the side, you see the reading in kilowatt hours, how we've reduced pre-COVID, and then, of course, how COVID impacted. And this goes to show the district really partnered with us to find, hey, what can we still do even though we are still using the sites a little bit? We're able to still bring that usage, that consumption across all our commodities down. Next slide, please. So on this slide, I will go over the electric and natural gas, and then Mr. Precy would like to go over the water and sewer. Here for electricity, we can see a 46, almost 47% decrease on cost from the base year to COVID, and you can see the dates here. Same thing with natural gas. As far as a reduction, considerable reduction of just over 59%.
And on the water, you're going to see that actually has gone up over COVID. And in about June timeframe, we made a conscious decision to go ahead and increase our water utilization because, in COVID, people couldn't go anywhere. But we knew they were going to use our schools. And we knew our school sites had brown and yellow grass, and we decided, we need to green this place up. So we actually turned all of our irrigation lines up to 100% and over a 5-day period of time to kind of green things up, knowing that our community was going to come to our school sites. So that although that's showing a 13% increase, that was a conscious decision on our part to make an effort for the community to have an opportunity to go play or maybe run the tracks or do certain things.
Next slide, please.
All right, so this slide is another one of those exciting slides because we're looking at our base year of an energy use index, which is the way the EPA calculates an energy performance for a building. And a score of 59.6, that's probably not so great. But you can see where we're at 22.7, which is an outstanding number. We need to be proud of that number because you can see just below that in the state of California, and this is post Prop 39, which was the proposition that the state put in place to improve energy and water utilization throughout the state. So after school districts had improved their utilization, they're averaging at a 41, which is pretty good. But we're at 22.9 or 22.7, which is outstanding. So this is really, again, hats off to the Center District team, hats off to energy specialists that we have, boots on the ground, making sure that we're working, hats off to the staff in our school sites that we're turning things off. And this is all pre-COVID. numbers. So this is really an outstanding performance for our team.
Next slide, please. So here we'd like to conclude and really give a heartfelt thank you, sincere thank you to you as board members, cabinet members, superintendent, board president. We really appreciate the partnership. We can't thank everybody enough. Again, between our staff, our support staff, and you as a district, we have done fantastic things, and hopefully, you know, we can get to number 1, 2, or 3 on that national list. In the spirit of gratitude, I'd like to introduce our Chief Revenue Officer, Tony DiSpiritu. He was so excited. He wanted to be out here, came out here from Rhode Island, so we thought maybe we could have him. I'd like to request from the board and cabinet if it would be appropriate to take a picture with the award, an excellence award with you, if that's okay. Either come up, or if you would prefer to come in front, or whatever is appropriate.
Can they just come up,
It
one
would
of us, or we can stand up?
If we could, we probably
stand
could
up,
stand
okay,
and they can-
okay, and then he can come up and present
Yeah,
the
let's
award,
see
and
if
we'll
they
take a
can capture
picture.
it.
Thank you.
See what happens. We're still being safe.
Board President Rogers, Superintendent Irvin, members of the board and the cabinet, thank you very much for the opportunity. My name is Tony DiSpiritu. I'm the Chief Revenue Officer of Synergistic, a 35-year-old company dedicated to energy savings, colleges and universities. It is true that I did fly in from Rhode Island, so I'm 3,000 miles away from home and fully vaccinated. Thank you.
And do you know the question? Do you know the answer to my question?
I do not, no ma'am, I do not know the answer to that question, but I can commit to getting an answer to you. So what we do on a very rare occasion basis is we recognize our top performing clients. We've been in business for 35 years with over 15 clients. We only recognize a very small sliver of them with an environmental excellence award, really in recognition of the tremendous partnership between our company and the district, really producing tangible results. You saw the numbers, 42 million cost reduction, 60%. Fantastic numbers. These are world-class numbers for the school. I'd like to recognize your leadership and the teamwork with Synergistic.
All right. Okay, just tell us where to look. Yeah, come on down. Thank you again. We appreciate it. And board, we will put this in a wonderful space to celebrate. All right, we're now moving to 7.2, school reopening update. Welcome, Dr. Funches. Team.
Good evening, Dr. Rogers. Good evening, Dr. Wyatt. Good evening, board. Dr. Irvin, our cabinet, community. Tonight, I'd like to share some very exciting news about getting back to in-person instruction, which we are all excited about. We're ready to welcome our community back with open arms or fist bumps, whatever is appropriate. But we all are ready to welcome our scholars back in our community back for in-person learning. So tonight I'd like to share with you what that might look like and some of the strategies that we put in place to keep our employees, our community, our scholars, our staff, our educators safe while we educate. So as you see the screen, it says better together, welcome home. We believe in that. We are better together, and we are welcoming our community back to in-person learning. Next slide, please. And so our purpose Our purpose is to successfully reopen August 2nd. That's 2 weeks from now, right around the corner. We're ready to welcome all of our young people back into our school sites, our leaders, our educators, our staff, us, so we can walk the campuses and walk classrooms and see exactly what's going on. And then we also want to make sure that we're following current state and federal guidelines so that we can offer full access to in-person learning for all of our students and families. And we want to welcome our community back. Like I said before, we're better together. We're ready to welcome everybody back into our campuses, our sites, our departments, and our buildings. But there's a way to do that. Next slide, please. So as you may know, the Centers for Disease Control and Prevention and the California Department of Public Health has gone away from, or has relaxed some of the distancing guidelines. They state that if we have these mitigation strategies in place, we can provide safe and sustainable in-person learning. So the first strategy that the district has put into place and will continue to mandate at this current time are face coverings. And learning how, or teaching everyone how, or reminding everyone how to wear face coverings properly over the nose and mouth. And then the second mitigation strategy is our air quality, our air ventilation systems, and our HEPA filters, which provides clean air quality every 15 minutes, like we have in here currently. And then our sanitizing and disinfecting, making sure that our wonderful custodial staff are going through and sanitizing our high-touch areas, cleaning our sites and departments, cleaning our school sites on a daily basis so that we have clean facilities on a daily basis. And then, as you see there, prevention and hygiene. One of the things that we need to make sure that we're doing appropriately and consistently is reminding our scholars, reminding our families, reminding our employees how important it is to self-screen, how important it is to stay home if you have any conditions that are associated with COVID. And then while you're on campus or in our sites and departments, make sure that you're practicing good hygiene, using the hand sanitizer stations and such. And then finally, screening and testing. We have our COVID liaisons, or we have our organization here, our partners from AM LLC, that will take us through some of the screening and testing protocols that they will be providing on a daily basis on our campuses. But as we implement high levels of screening and testing, that's another mitigation strategy that will keep us safe as we provide in-person learning. And then should there be a case or should there be an exposure, we have implemented strong contact tracing measures for both our employees and for our scholars who will be entering our campuses, and we'll allow our COVID liaison staff to speak to that briefly. So we'll move on to the next slide, and I'd like to introduce tonight Mr. Neftali and Mrs. Mary from AM LLC, who is part of our implementation of COVID liaisons at our school sites, and they'll take you through what that might look like and the services that they'll provide. Thank you.
Thank you, Dr. Fanches. Good evening, members of the board. My name is Naftali Odongo, Director of Corporate Continuity for AM LLC and the acting program manager for this project. So we'd like to thank you, first of all, for giving us the opportunity to serve the community and also just to discuss through our COVID liaison program. So what you're seeing on the screen are the 7 pillars of our prevention, management, and support plan. And me and Mary will go over the plan in detail right now. So the first one I'd like to start with is the prevention aspect. We mainly focus on prevention so that to encourage the continuity. And with that, we have we empower for self-assessment by providing education and also facilitating temperature screening. And my team is working closely with the school board and the local public health, the municipality, county public health system as well, to just be able to work with the updated CDPH guidelines and also the CDC guidelines. So to make sure that whatever is being implemented is actually the most updated guidelines. Next on there is on-site testing, and I'll let Mary speak to that.
Good evening, everyone.
Thank you.
My name is Mary. I am our acting clinical project manager for our San Bernardino liaison program. My educational background is nursing and public health as well. I'm very excited to work alongside with you and serve this community to have our students in-person learning this year. As far as testing, there will be testing services provided within the school to help with the convenience for families. This will be done, of course, with absolute parent consent, and parents will be notified before we ever test a child. This will also be at no cost to the family or student as well, and we can also provide testing on site to staff members.
For education, we want to just create the awareness and empower the community itself. So we'll be providing through our platform, we'll be providing like COVID-19 information to the families and also the community if available or if interested, so that they can learn more about the updated, accurate COVID-19 guidelines and also procedures coming along. Our liaisons also, for them, we have continuing education. So currently they are ongoing the training and will be ready to be in the schools. And even after that, our training will still continue between the periodic training to make sure that they're sharpened and they have the updated support they need to be successful in the schools. Next, Mary, family support.
We are also able to provide families that would have impacted students, whether it was a close contact or unfortunately a positive case. If that were to happen, we can provide resources for them, social service resources from a federal all the way to a local level, and as well as educational materials for the family as far as quarantine guidelines if needed, and any other support that the family would need. Our liaisons are available to help support our families as well as our leadership.
For project leadership, we have a program manager. I'm the acting program manager. We have Mary, the clinical project manager. We also have an operations manager and a lot of support from our educational, our corporate education, who do a lot of research into what's going on, what is working, what the future looks like, and do a lot of analysis. So together we work to make sure that we are providing the updates to our team and just empowering them to be successful in schools. Next one, I'd like to say, to talk about the local focus. So for us, it's important that we work with the community. And one of the best ways to do that is to make sure that our staff are also coming from the communities. So we heavily hiring people from the community so that they can be able to, who are passionate about serving children, who are passionate about working to mitigate and prevent COVID-19. And also to just do contact tracing and reduce exposure in the schools.
So next, for contact tracing, a really unique aspect of our program is that we are able to provide contact tracing from the school site itself, and you know, versus having to wait on reporting. We are providing the testing so we can provide the contact tracing immediately, boots on the ground when we have a student that would test positive. We are able to manage both positive and close contact cases as well. And then the next item is clinical support. Our liaison staff will have a wonderful leadership team built of registered nurses to provide that clinical reach back support when needed, and just the extra leadership as well for the liaison program.
Well, thank you. So as you can see, our COVID liaisons at each one of our school sites provides another layer of support for prevention, for education, for exposure protocols and contact tracing and such, and even making sure that we tap into our community resources for employment. So that's great. We're going to move on to the next slide.
I'm taking names. I do have names. have names. I think they got a couple more slides, and then I'm gonna go to. Go ahead.
Along with the prevention measures at our school sites, there's also our staff and our employees. And if you look at the prevention measures, one of the things that stands out most is making sure that our employees are aware of self-screening and taking care of themselves. So should they have any exposures, or should our employees feel at any time that they're exhibiting symptoms, then we're asking them to stay home and self-quarantine. And we have a process for that as well. Notifying their supervisor, emailing COVID cases, filling out the questionnaire. Our contact tracing team that serves our employees will get back to them and make sure that we follow the protocols for assessing who they may have been around, assessing if they need leave and what types of leaves and such, in conjunction with human resources or employee relations. So that's part of that process. That's key in making sure that we maintain a safe in-person work and in-person learning. Next slide, please. So with all of this, how do we get the word out to both our community and our employees? And our communications department have done a great job, or has done a great job with that. And some of the strategies that you see there, if you look on social media right now, Instagram, Facebook, you'll see those things. The Know Before You Go, I've read those, I've shared them, I've liked them as well. Providing our parents with updates and pointers, if you will, for in-person learning. And then the Hope News for employees, giving our employees an update around COVID-related topics. The e-news and notes for our families, videos and stories will be shared and going out. Letter from Superintendent Doc Irvin that welcomes our employees back and gives them a rundown of some of the things that we're doing, many of the things that we're discussing here, so that we can keep them safe and keep everyone aware of what's going on. The robocalls and text messages to both our employees and families, look for that, those of you in the room now. And so our Parent Square as well, which you're probably getting messages from now, that's a new venture in the district to make sure that all of our parents are receiving the same information across the district, no matter what school site you're at. And then I'll share the roadmap to reopening, which some of you have been a part of, making sure that our employees, our families, and everyone across the district has an understanding of what we provided here, or the things that we're putting in place. So next slide. I would like to thank our Superintendent Doc Irvin for his decision-making and input here to have a roadmap that not only provides this information that we shared here to our employees, but to our families and everyone across the community on what we're doing to reopen safely. And some of you were a part of that process as well. So that roadmap to reopening will be at all of our school sites, department buildings. It will also be mailed out. It comes in an electronic version and paper version as well, and translated. So it's a good thing so that we can all be on the same page, make sure that we are practicing safety ourselves, and then coming together collectively to provide safety across the district. So that's our reopening, our presentation. That's what we're doing to keep everyone safe and welcome all of our scholars back on August 2nd, 2021.
Thank you, Dr. Funches. And we have some questions. Mr. Tillman, followed by Dr. Flores.
Yes, thank you for the presentation. I have some specific questions. I know today at the Wall Building, somebody tested positive for COVID. I guess they tested yesterday and they came back positive. But I think it would help if a person tests positive, right? Then I'm assuming that there's some things that come into play now because of people being able to be vaccinated, right?
Right.
So if a person tests positive but they're vaccinated and they have symptoms, are we telling them that if they have the ability to telecommute and their supervisor agrees that they're going to be allowed to telecommute?
So we are not saying that. I think there was a miscommunication around that, Mr. Tillman. If you are quarantining because there's a positive case and you've been exposed and we've asked you to quarantine, we are not asking you to telecommute. We are asking you to quarantine and get yourself healthy.
Now, that's until September 30th, right?
So September 30th is when the the leave goes away, where we allow you to take leave provided by the government, so it doesn't come out of your existing leave banks. But if you if you're exposed at work and you're exhibiting symptoms, we are not asking you to telecommute. There's some liability in that. How can you effectively work from home and you may not be feeling that well?
Okay, so you're saying if someone tests positive, at this point, they'll take the 80 hours leave?
Yes.
And there's no provision to allow them to telecommute, what you're saying?
We are not asking them to telecommute because they've tested positive or exhibiting symptoms, and so they should take care of themselves and get healthy.
Let's take it to the next step. So then there were people that you're doing contact tracing. So say there was people that said, I met with that person yesterday. So they were in the vicinity. So are you asking those folks to
So if you've come into contact with someone and you're exhibiting symptoms, we are asking you to self-quarantine as well.
If you're not exhibiting symptoms?
We're asking you to self-quarantine, and we do have paid leave up until September 30th, and we do think that will be extended.
I hope. And I'm hoping also because of the Delta variant.
Correct.
It's a big change now. They say, 64% of people has efficacy protection up to 64% for the people who are vaccinated.
Right.
And the good thing is 97% efficacy for people not being in the hospital and dying, right?
Right.
So that's a big deal.
Right.
But so you're saying that it's going to be, if you're in the vicinity, you're going to
determine through contact tracing.
Right.
Should we feel that you were in that vicinity and we need you to self-quarantine, we will ask you to do that.
And they can use the 80 hours.
Correct.
And then in terms of when we go back to school, there's a class. If a student tests positive, is the whole class going to be asked to do class remotely, or is it going to be the students that were close to her and the teacher? How's that going to work?
Fairly. So I'll have Mary jump in there with the isolation for students in case that happens.
So the current CDPH guidelines for close contacts, there's a few things. If the children or the students were unmasked during that close contact, the child would be required to quarantine as far as the CDPH guidelines. If the students were masked during the close contact, the child must remain asymptomatic, and the parents must agree to be tested on site at the school twice in the first week, twice in the second week. If at any time, those come back positive, of course, they would be sent home. If the child has any symptoms, even a minor headache, they would be sent home as well. As long as they stay asymptomatic and their families agree to them to be tested, the current guidelines are they're able to stay in school under monitoring. They are not allowed to attend any extracurricular activities. And if a classroom has more than 3 positive cases within, I believe it's a 14-day period, the entire classroom must go home and quarantine, or to come back to school must have a negative test.
And the classroom that's going to self-quarantine, how is education continued?
So the classes that will self-quarantine, we are working on plan for virtual learning because we don't want to have scholars out or not being provided with instruction.
The quarantine is going to be for 10 days, right?
It would be for 10 days or a negative test.
I'm talking about in a scenario where you had three students in the same class, which means you're going to make the entire class self-quarantine, right? Including the teacher, correct?
Yes.
And does that mean, is the teacher going to teach from the class or the teacher going to teach from her home or his home?
So as stated, we have substitute teachers that can provide instruction when there's a case like that. If there's a teacher that's been exposed and needs to self-quarantine, we would take those steps for that.
But if the teacher doesn't have symptoms, is quarantined, and you have the scenario where 3 of the students test positive, so the whole class goes to quarantine, is that teacher going to continue to teach if they're not demonstrating symptoms?
Gotcha. I understand that question. So in that case, we'd assess the situation, and we may allow that educator to continue because there are no symptoms being exhibited.
And would they be educating from that classroom or from their home remotely?
That's a great question. I think that's something that we need to continue to explore, Mr. Tillman, because I don't want to make a misstatement here. So
right, and that's why I think it's good that we ask the questions now before school starts.
Sure.
Even at my job, it was surreal because the county moved, the day that the county said you can take off your mask if you're vaccinated, someone tested positive in my office. And then so all the verbiage didn't make any sense anymore because you're not telling people that someone tested positive, but we're wearing masks and because all of a sudden they gave the impression that no one's going to get infected again. Right. So it was a touch of reality that no, people are still getting infected with the virus. So I guess the contact tracing part is important. So I just want to be clear that we're thinking that for regular staff and offices, if they were with someone who tested positive, they'll notify their supervisor and they'll self-quarantine.
Yes.
And right now, there's no provision to telecommute. And the thought being that, in the hope that you'll be able to, that it will be extended after September 30.
Correct.
And if not, then we'll revisit the issue.
Yes, sir.
Thank you.
Dr. Flores?
Yes, thank you for the presentation. Appreciate all the work that you're doing. It's very complex, very important work. I have several questions, as Dr. Funches knows. I'm really concerned. I hope that we do extend the September 30th date. And is it our legislature
That's
that
a
does that?
statutory date.
Pardon me?
That's statutory.
Federal.
They put the date.
It's the federal government?
Yes, it is.
That will do it? Okay. Do we have lobbyists working on that?
I'm pretty sure they are talking about
They
that
are?
as it's
Okay.
on everyone's mind, especially in light of the variant. and such.
Because, you know, the rates of infection from Delta are going up. And as we heard from Mrs. Leonardi, our hospitals are,
List every Tuesday
okay,
between 8 and 9, so we'll take a note of that and add that to that conversation.
Do.
yeah, and even Jim Davenport too, I think. That's in Washington. When will the next question is, when will our employees get this information? I know you said you're going to send out an email. School's starting soon. I've been asked, people are asking me, well, what is the roadmap? What are the, we need information. How is this all going to, evolve and come down? And they're anxious.
Right.
So,
Dr. Flores, so right now on our district webpage, we have been providing snippets and information for COVID. What you see here in terms of the COVID, the roadmap and such, that is going out, and I want to say, Dr. Menares, if I'm correct, next week.
We actually, Ms. Ontiveros and I were just meeting before the board meeting. We will have the final draft ready to be emailed out tomorrow, and then the printed copies to our school sites and our district buildings by the 28th. There's a letter that's going home, being mailed out both to our families and our community from Mr. Irving, welcoming them back, letting them know about this roadmap and where they can get the PDF copy if they'd like that. And so that's all happening starting tomorrow, and we will be sharing and emailing the copy to our site leaders tomorrow. We've been, making sure that we've stayed up as much, making those necessary changes.
Dr. Menares, so the email to our employees will go out tomorrow?
Yes.
That they will know, okay, and then the
The
hard
roadmap itself will go out tomorrow, yes.
in their emails, okay.
Yes.
Good, okay.
You're
They're
welcome.
anxious.
I'm sure they are.
Yeah. And then we'll have hard copies for everybody.
Correct.
Okay, great, okay.
And there is also the robocalls and text message that'll begin as well.
But our employees need to be
Correct.
advised of it. I mean, our teachers are coming back, they don't know. I know our classified people also need this as well.
That's
Need to
part of
know.
it as well.
Right, okay. The next question is for you, Mary, for contact tracing. I assume that you have very rigorous protocols in place to do the follow-up and so forth. And you just mentioned our students. What about our employees?
My understanding, we will provide all of the contact tracing and collect the employment information, and then we will provide that to the employment contact tracing team
As well?
yes.
So you will not do it, but there's a team of for employee contact tracing?
Yes.
We
Are
have that
you-
in place.
Are you part of that? Are you the,
I am not. We will just provide that information to that staff member, but I am working with them.
We have that in place right now where where we provide contact tracing for any employees who come into contact with possible exposures.
I'm concerned that, say they get COVID at work or, and so forth, then, do they know that they will, up until September 30th, and unless it's extended, that they will get those benefits, right, for the 10 days and not taken out of their leave?
Correct.
Correct?
We've communicated that. We work with our union partners on that in negotiations. And
Okay,
if anyone does not know that, we'll provide that information at any time.
But then after September 30th, we don't know. What will happen if it doesn't get extended?
Well, before then, Dr. Flores, just to be honest with you and transparent, before then, or we already are right now discussing as employee relations, what do we do in that case? So we're starting work on that right now in terms of looking at our contract, looking at how we can work with our union partners to provide.
Oh, so you're working with the
such leave.
unions right now
We haven't
to clarify
started
that?
working with them yet, but we're working in employee relations before we go to our unions with that, with any language or any updates.
Well, I think that's really important because if they got it in our workplace, we need to provide, standard protocol that is fair and equitable. Okay. The on-site testing is upon request, either by parent or teacher or principal, or is it the parent?
So for staff members, it would be upon request. We are only going to, at this time, test symptomatic children and children that have been within close contact, but with parental consent. And we would notify them and have a conversation beforehand.
And that will be in the specifications, so parents will know that?
Yes.
And
Correct.
teachers will know that?
Correct. And we
'Cause
also.
I didn't see it on the slide. I know you had to do just icons and so forth, and capture what was that? Okay, so.
Dr. Flores, it is within the scope of the work, and there's also provision within that scope that if any of our employees just want to receive a test, they can as well request that.
And I know the main bottom line is for us to, provide safe and healthy, workplace and learning space for our kids. So that's why I'm asking you all these questions. And then is it even possible, say that we have vaccines ready for the children, under 12. Are we capable of doing that at our school sites? Is that in your contract? To issue or to provide vaccinations?
That is not in the contract.
Not? Well, I'm anticipating it, so I just wonder, how we would do that,
Sure.
if it's
So
possible.
I think that's a deeper conversation that we can have as a district and then bring back to our board to have a discussion around that, just because vaccinations are a sensitive topic with families and parents. So we can take that and bring that information back to you, Dr. Flores.
Right, that's a really big question on my mind. When they do say push go to give the vaccinations to our kids that are under 12, what are we going to do?
Dr. Flores? If I may, so we have been partnering with our public health providers, our county public health, to offer those vaccinations throughout the community. And so as soon as it would be available to our younger youth, we would continue that and we would up it with them. So we provide the space, we help with the advertising, we get the community there, and we allow them to do what they are the experts in the field of doing. But absolutely, we want to get as much vaccine, or we want to get the access to our families.
I just want us to be clear on all the different aspects, especially not just for the children and the families, but our employees. Our employees have to know that we have their back, and that we, also have, standard protocols and so forth for everything. And it has to be visible. And, I'm glad that you have them on the website and all of that. But, just reading it, I think you need to have dialogue with our employees and I don't know how that's going to happen, but I think that probably at school sites, I'm not sure how that will be done, because it's one thing to read it, but then it's another to have dialogue and have them be able to ask questions as well. Hope that you consider that as well. Thank you. Thank you, Madam President.
Ms. Rosales Medina?
Yes, thank you so much for the presentation. I do want to mention that I give kudos to the communication department because I do see those posts. I get really excited when I see how they're, transitioning with different topics and how to prepare coming back to school. So that's amazing, and I wanted to give them a shout out. So thank you for doing that. When it comes to AMLCC, I noticed that it was at the last board meeting agenda, right, that they were approved. It was up to $6.3 million. And so I just wanted to note that only because I'm looking at the services you'll be providing. How many people do you expect to have, because it's for a 6-month contract from July to December. How many people do you expect to start working within the school district once the school starts?
So we'll be having one person for each school.
One person for each school?
One person for each school. That's just for the COVID liaisons. And then we'll also have cluster or regional leads. So those will be like registered nurses who will be providing them like satellite support. And then on top of that, we'll have like a data analysis team. We'll have like a training and education team, the project manager, so several people. So are you asking for the number of people in the schools or total amount of people we expect to have?
I'm glad you're able to specify at least per site is one, but then
Yeah.
within the whole team, you're saying there's going to be registered nurses.
Yes.
And then, because I was looking at the contract just to make sure, because I know that was a question of mine back at the last board meeting, and just seeing the work that you would do and the scope of work that you would be doing.
Yes.
And then how does that compare with the county? Like, for instance, you mentioned the testing, that, you would look into providing that. Would that be through you directly with AMLCC, or would this be something that you'll connect with the county? So I'm just curious on that.
So the state of California through CDPH has actually, we will be provided testing supplies and kits through the state. And so we will help facilitate that testing. It's all self-swab kits, so the students and staff will actually perform the swabs themselves. But this will be done at the school and provided at no cost from the state.
How long before the results?
They are guaranteed within 48 hours. When we spoke to them, they are currently seeing a turnaround time of 9 hours for a PCR test, and we also have availability to do rapid antigen test. Those just are not, they cannot be used on symptomatic
Okay, thank
people.
you. And then also within, Dr. Funches, within our school district, are we having them also work with them directly with this? So that way in the future, because this is like for 6 months, then how can we eventually at the end start doing some of, not maybe we don't have the registered nurses, but we can definitely help facilitate the process that can alleviate some of the work that they're doing.
Mrs. Medina, so as we learn and as we go through the beginning of the school year and we learn from AMLLC and we put our systems in place, we are doing just that. We're
Okay.
evaluating what we can do as a district. Should we continue with AMLLC, or should we do the services or provide the services ourselves? So that's part of the evaluation and assessment process that we'll undertake.
All right, perfect. Thank you so much. Thank you.
You're welcome.
All right, Mr. Tillman?
So I need clarification on the quarantine. So let's say, for instance, someone tests positive, someone was next to the person. Do they automatically quarantine even if they're vaccinated without symptoms?
So through the contact tracing process, if we feel or if we determine that they were in close proximity and we need to quarantine them, we will, Mr. Tillman.
Well, my question is, and how long is the quarantine?
10 days or negative test. So we have the ability to take a test or the employee has the ability to take a test and show us negative results, and that would negate the 10-day quarantine.
And I'm telling you why that's significant. Because if you get 80 hours only, right? So say for instance, I'm in close proximity to someone.
Sure.
So based on that, you tell me I have to quarantine. But if I were to use in my 80 hour, but then I really get
Right.
symptoms and thinking I have the virus, if I don't have money, I'm not gonna get paid, then I might walk around with the virus because you're telling me that I use my 80 hour, I'm not gonna get paid.
Those are good questions. So right now, as a district, what we've done, if there have been things that happen within our sites and departments, we allow them to take that time. We wouldn't charge it to their account. So what I'm saying is, if something happened outside of the district, then of course, we'd look at their own leave provisions. But if it's because of in-house or you've been exposed in the district, then we provide that 10 days. That's what we've been practicing.
But the big question is this. This is a perfect scenario. So a person's being quarantined right now.
Sure.
Only because they were in close proximity and they're vaccinated already.
Correct.
You're saying they could be out using the 80 hours.
Sir.
But if, we don't know how they got it, but they come up and test positive, are you saying you're not going to let them use district time, that use their own time? That's the big question.
No, it's the 80 hours. It's part of the SB 95, 80 hours of leave because they've been exposed to coronavirus. So
But
they
I think
have
you
that.
guys,
That's within the
but
law.
I think you're missing my point. The challenge is going to be if you're going to have people use 80 hours just because they're in close proximity, there's still a good chance that a person, you're going to have it happen, who has been quarantined but didn't get the virus, may then get the virus and not have the 80 hours. So then that's going to be the question. And really, I think we need to be more realistic about it. And that's why I asked the question earlier about being able to telecommute. Because if a person's in the office and they can do their job just as easily telecommuting as they can in person, then as a district, we should allow them to telecommute. Because then I don't put them in a predicament where at some point, if you use your scenario where I'm using the 80 hours because I was in close proximity, and now I go out over the weekend at an event, and then I test positive, and you say to me, well, you used your 80 hours already, so therefore you're going to use your own time now. That to me is not fair. And that's why I think if it's possible that a person can telecommute, the district should in every way do that. We do that at the county. I had someone who tested positive. There were people that were close to them. They are able to telecommute and do their job. So we say telecommute until you test negative and no symptoms, and I don't do it, but it's the wellness center, right? And then they contact the wellness center and they come back. But I do think you should consider using the telecommuting as a tool to allow people to continue work, to preserve that time, because I know in the end, Dr. Funches, you guys aren't going to say, we're going to allow you to use district additional time. The only time that anyone's being given is the 80 hours. So I think we should cherish it. And for the people who are in proximity but have been vaccinated, it happened at my job. No one came up with symptoms, and no one ended up being ended up using time. The ones who couldn't telecommute, you didn't have symptoms, but you've been vaccinated, you would continue to work. For those who could telecommute until they tested, we allowed them to do that. I just think that the district should consider doing that.
Thank you, Mr. Tillman. We'll take that into consideration. I will respond this way. For the 80 hours, we have not allowed those employees that have needed it twice not to have it.
Perfect.
So there's liability.
Okay,
Have
thank
them,
you.
but we'll take
I'm
care
glad
of it.
you said that. That means a lot. Thank you.
You're welcome, sir.
Okay, and Dr. Flores?
Yes, I forgot to ask, and before I ask the question, I agree with you, Mr. Tillman, that if they're quarantined and able to work, they should work from home, because we know they can, and I would support that.
We'll bring back that information
Right.
because there is some
And
liability
also, I would
there.
support that if the teacher is not showing symptoms, but the kids are just quarantined, it's better to have your own teacher than to have a sub for 10 days. That would be, we need to have, unless the teacher's sick, right? Unless the teacher can't teach. But my question was, today I got a text message and a picture from a mother that said they had to wait 20 minutes for temperature check. So are we having temperature checks every morning when kids and staff are coming in to work?
We are still having screening. What we can do is assess that process or that system at that particular site to see how they have it set up so that
Is
we can
that screening?
expedite
Is that
it.
what screening is,
Correct.
the temperature check? Okay, so my question is, how are 3,000 kids going to be, how long is that going to take every morning for them to be screened?
So my answer tonight, Dr. Flores, is we need to assess those systems from site to site to make sure that they have them set up in a more of an expeditious manner. So
Is CDC still requiring that?
We are still doing
Yeah, we still,
screening.
CDC is still requiring that? It's still, okay.
Still
all
following
right.
the guidelines.
But we'll assess that situation as they come up. For example, that school you're talking about, there's a lot of different strategies that we can use to make sure that that doesn't happen. But again, we're going to have to deal with it on a case-by-case basis
Right.
and a site-by-site basis.
And that includes our employees, right? Our employees have to be screened.
Still do on a
Right.
daily basis.
And what happens if their temperature is high?
Ask them to alert their supervisor, self-quarantine if they are
So they
exhibiting
can't go
any
into work
sys-
that day
any
because
symptoms.
as they entered, they had a high temperature.
So yes, if you have a high temperature that's over normal, then apparently there's something going on and you're probably ill. So we're going to ask you to not work that day. Go home and take care of yourself. That's self-care. That's the whole part of health and wellness.
Okay. And that's explicitly stated in the roadmap, in the protocols?
Well, it's stated in what in the roadmap and in the protocols that we're sending out to our staff.
Okay.
Dr.
okay.
Flores, yes.
Okay, good. Okay, thank you.
Yes,
You're
also
welcome.
in the roadmap.
It's also, okay.
Yes.
Okay, good.
Appreciate the questions.
Thank you.
All right, I think I covered everyone, right? There was no other, okay, I wanted to make sure, cross them off. All right, so thank you again for your presentation. Very complex, not the presentation, great presentation. It's the, what, was it you, Mr.? That's what I thought. Okay, go ahead.
I just want to be clear, Mr. Francis, because, you know, the letters you guys are sending out is saying that after the 10 days of quarantine, you must submit additional HR 15 selecting CDC, and we're writing in description of which leave options she selects from the employees on time, applicable available leaves. So, it gets back to the if you're going, and you guys are, if you guys are going to tell people that they have to use their own time, you're going to cause a problem. Because I'm telling you, the problem's going to be people will literally come back sick rather than use their own time. And that's the reason why they did the whole thing with the 80 hours to begin with. And I still say, especially for quarantining, if a person is vaccinated and doesn't demonstrate symptoms, you should consider allowing them to telecommute, and you can do it, it's legal, so that you maintain that block of 80 hours as long as possible. The 80 hours should be used when someone tests positive.
Mr. Tillman, let us go back and take a look at that.
Take that
But
under
also keep in
advisement.
mind that everyone can telecommute, but again, let us go back and take a look at that. And we made note of that and give us some time.
Thank you. And I, you know, I only emphasize it because it starts here at the board meetings. And the message has to be clear. And you guys don't help us when we have the meetings and you tell me something and I go tell the employees and they say, well, no, this is not true. And they show me something that contradict what you guys have told us. So we have to be consistent. And I just hope that we use this meeting to find ways to ensure that we're providing the staff with as many opportunities as possible to not use their own time. Because I already know what's going to happen. People will rather come back to work sick rather than to use their time. And that's not fair, especially if we're mandating that because you were in close proximity to somebody, but you demonstrate no symptoms, that you have to self-quarantine for 10 days. That doesn't make any sense, and no one's doing that, even at the county. If you are with someone, you've been vaccinated, the first question they're gonna ask you, do you demonstrate any symptoms? If the answer is no, you continue going to work.
Mr. Tillman, we'll bring that information back to you.
Thank you.
Welcome.
Ms. Ceballos?
So I wasn't going to comment, but Mr. Tillman, I think we're missing a very key piece here, and I think that is testing, right? So employees rather than be sent home to quarantine when they're asymptomatic, the best approach would be get tested right away. And if you come back negative, you don't have to use the 80 hours. So I think the emphasis here really needs to be on testing, especially for those asymptomatic, students or teachers or whomever, right? So I think the focus needs to be a little bit more on the testing availability and really pushing our staff and parents, informing them that the best way is through testing.
Thank you.
Exactly, and thank you, Ms. Ceballos, for that, because I was getting a little confused as well, because earlier we talked about, if a person is sick, then on one hand, we're saying go home to be sick, but still work. And we started out with that, their wellness being very important. So we do have to communicate it properly. And the biggest thing that we're gonna find out is, through my job, and, everything is different, so I hate to refer to our personal things, because everybody's doing little things different, but the testing, like you said, because that is the determination, because you said on one end, you said quarantine or test. And then we kind of talked about some other things. So for those that are watching and for our staff, we got to be clear on what we're saying to them. And as it was mentioned earlier, we definitely want to make sure that our lobbyist is out there. I mean, we did it on some other things that were needed under COVID, and we definitely need it here on that extension. So that's a hopefulness side of it. But again, we have to go back. I heard her say that there are some times we can do the rapid test. So that's an immediate test to let us know sooner than later. I think when this all started, it was days and 48 hours, but we can get this done quicker too, because we do want our staff connected to their students. So clarity again, because I personally we kind of talked about so many different scenarios I can only imagine. So I don't know if this is even in the roadmap for teachers as well, but we do want to have where whoever we're sending to align to, this is where the answer is, and have it, this is obviously going to be a working document, because you're doing electronic, where you can change, because we know the CDC and the guidelines. I'm seeing, when, as you guys talk, believe it or not, there's audience saying there's people saying no. So that's just a sampling of, we just need to make sure that we are on top of whatever is the latest.
Bring back the information on the 80 hours and the leave and possibility of remote work. I think that's where the issue is.
Correct.
We haven't done that because of the liability.
Yes.
We'll bring that information back.
Okay, I think I got everyone. Okay, thank you.
I think Dr. Rogers will bring clarity to it.
Thank you.
And we'll try to bring clarity to it as soon as possible, either through a Friday update and also at the next board meeting. But if we can get that information in a Friday update and bring clarity to it as well. And I'm sure Ginger took down a few things over there and some notes to get some clarity on the 1 or 2 points. But let us debrief tomorrow as usual, and then we'll try to get clarity ASAP before we send that document out as well.
Yeah, because that document is going to be,
Right,
once
but it
it's
may
out.
be a delay if there's a change, but I'm assuming we may not have to. Dr. Menares?
Yeah, if I could just clarify. So in the document, we have a page that is the self-screening page that it's very visual, so it has step-by-step what to do, and then it has if-then. So if you're vaccinated and you're asymptomatic, this is what you do. So it's not just for students, it is for staff.
Okay.
So that's also there. We put it at the end so that it's easy to find. It doesn't get kind of caught in all the language. So that is there for our students and our staff. It was, the document itself was primarily written for, with a parent lens, but we knew that because we compiled it into one space, then anybody would be able to access it, our office staff when parents are calling, as well as our employees. So it's there.
Good. Thank you. And thank you for your, did you have?
I did want to thank Mr. Jose, our custodian tonight, being on hand to make sure that we're keeping things clean and disinfected as we go.
Appreciate
so
that.
thank you, Jose. Much appreciated.
Thank you so
Yes,
much.
thank you so much. And thank you all for the presentation, and we learn more as we go. And definitely we took note of that cleaning. Thank you.
Thank you.
All right, we are now moving to 7.2, school reopening update. I'm sorry, you just did that. 8.1 board member comments. So I'm going to start to my right this time. And so, Mr. Tillman.
Thank you very much. And just for clarification, and I know it's not agendized, but I do want to mention that in the the Friday weekly update that the board gets, they did mention in here about shutting down the community day school. But I talked to Mr. Irvin, and he said they're not going to shut it down unless we know for a fact that the county has a community day school for elementary schools. And just so board members know, where the elementary community day school came from, years ago, we had a number of elementary kids who were expelled from school, and they were just at home in the streets for the whole year. And so we knew that wasn't the best scenario, and that's why we created our own community day school for elementary kids to make sure even when they were expelled, they could still be in a constructive environment. And the board, on purpose, said there would be 2 teachers and 2 counselors and no more than 10 students in the class. So if we're getting rid of it, I'm assuming that we're going to replace it with something different. Right now, I'm hearing there isn't anything for sure, so we're not going to get rid of it until.
We're working on it.
Okay, so, but we're going to, because the BC said that as of 2021, 2022 school year, we were going to eliminate it. But
That's the plan.
But we're not. But we're not going to get rid of it until we have a replacement,
Since
right?
we have a replacement, and we're working on it diligently, but if we don't have it in time, then obviously we're gonna have to postpone that.
Thank you.
But we wanted to make sure that the board was aware of it. Is there anything I'm missing there, Dr. Rodriguez? No? Okay.
No.
Thank you very much. And then in general, I know the administration is working on a plan to spend the hundreds of millions of dollars that we have in one-time funding. I want to just be the voice of a voice in the district that explains the complexity. We have hundreds of millions of dollars of one-time money, but not ongoing money. At the same time we have this one-time money, we still have a structural deficit in our budget for ongoing money. But with that being said, I hope that everyone is asking for things that can be things that they've always wanted in terms of one-time money that can be spent immediately, because it's only for a limited amount of time. I see Mr. Michael here from our CIO for the district. I hope that we're taking care of buying equipment and backup equipment that we need with some of that money. That'd be a great use for this additional funding, so we can do our bare metal restores, right, in case we have problems there. And even for our parent groups, I'm hoping that the parent groups are going to be given some extra funding to do some of the things that they've always wanted to do. The worst case scenario would be to have hundreds of millions of dollars and then have those groups asking for things that cost not a whole lot of money, but will make a big difference for the parents and the students. So I know Mr. Irvin said they're doing the plan. I'm hoping that the input is being given and that it'll be acted on. I want to commend Mr. Irvin on, I've heard from staff that they're getting devices and computers. That's a big deal, because that's something that we should be doing right now. Everyone that needs a device should be getting it, including our students, and you told me we're doing that also. So we talked about I know there'll be 5-year renewal or whatever you're doing, but the beautiful thing is we know we have this one-time money, and it's important that we spend it before the 5 years. So it sounds like we're doing that, and that's a good thing. So with that, I want to say thank you, but I just hope everybody's on the same page. We have one-time money. We do not have ongoing money. Thank you.
Just come down the aisle, yeah.
Thank you, Mr. Tillman.
Ms. Rosales-Medina, no, were you shaking no?
Were you gonna speak?
No comments. Okay, you're shaking no.
I heard her. Thank you, Mr. Tillman. You always, I appreciate your words of wisdom and your foresight tremendously,
Thank you, Dr. Flores.
tremendously. And I also want to commend Mr. Irvin for your leadership so far, and also the cabinet. All of you are working very hard. You have bags under your eyes. But I really do, I think we all appreciate you very much, and lots of confidence in your leadership and the work that you're doing. And this will be the meeting before you all come back to school. The teachers are, and I just want to welcome everybody back. It's I was a little excited last board meeting because I haven't seen my colleagues. It's real important for us to be together, and I'm glad, but I'm also cautious, and that's part of my comment today. We really have to, Mr. Irvin, have to be really cautious about the Delta variant and looking at our county to see where we're at and to mitigate, we know how to shut down, that for sure we do, and I hope we don't have to. But if it gets really, really bad, and it's scary because I've read articles where children are dying of the Delta variant, and that's scary to me. And I would never want that to happen in our district whatsoever, or for anyone, adult, families, and so forth. So we're going to open with caution and with safety, as you saw, the precautions that we're taking. And we just have to be patient with each other, communicate, support each other. And I have great faith in everyone to work together and be caring and loving and compassionate so that we can move forward with our children and our staff, I look forward, I'm a teacher, and I've been a teacher of teachers. And I'm kind of excited about the directions that we're going to be going in terms of, I was a professional developer besides being a professor, a teacher of teachers. And I know that professional development works if it's long-term, steady state, and teachers are supported by everyone, central staff, district personnel, also site principals, and so forth. And I'm really excited that Ms. Kolker is going to be the next director of elementary ed. I have great faith in you. You're highly knowledgeable and a great leader. I was always excited to see all of the innovations that you had successfully implemented in Bradley. And so I know we all can do it. So just open up and be loving and work towards, for the best for all our kids. Thank you.
Dr. White?
Thank you, Madam President, and just want to piggyback off Mr. Tillman, and I really appreciate hearing that the tech devices are getting out there to our staff. I think we had a conversation earlier about making sure we spend these one-time funds. And obviously the classroom is where we want our funds to go to. I mean, that's where we get the best return on our investment. So great to hear that. I know we have a guest in the crowd out there today that's waiting for her device as well, so I'm looking forward to hearing from her too when she gets it. I did make a comment at our last board meeting during my board comments that I hadn't heard anything during summer school on some of our, how it's going out there, kind of our trial period on returning back to in-person teaching and learning. And I got a response from that, so I'm glad to get that response because then we could come back and work with executive cabinet. And one of the concerns was about hand sanitizer, and that there was a very large consumption of hand sanitizer, especially at the front of the school when people were coming in and out. And we were assured that last agenda review with the executive cabinet that there is a ample supply. They were emphasized that about how much hand sanitizer we have in the warehouse. So we want to make sure we get that out there. We have the 1-gallon pumps because there was a concern about the battery operated devices going through hundreds of batteries, which I can understand. We're also assured that, where we can, we'll plug those in. We have plug-in devices, and if not, then we need to get those 1-gallon pumps out to our sites and utilize them that way. So for those members that are out there, our staff that were concerned about that, we definitely have a solution in place for that when we get back to school. And it was a good test run, like I said. Looking forward to our summer graduation this Thursday night. Do we have an idea how many graduates we have for this graduation?
I believe it was about 247, which is the largest that we've had since we started this summer graduation.
Oh, that's fantastic, because I know, it's been a tough year for our kids, and that extra time enabled a lot of our kids to still graduate this year. So So, and I've been to a ceremony actually at the Way World Outreach Church, and I'll tell you what, they put on a really good show there, and looking forward to that. So again, great job. I want to thank Cajon High School. They opened up for our wellness conference for the County Office of Ed. As always, did a phenomenal job performing, and also our San Bernardino Teen Music Workshop. And many of us saw at the last CSBA conference when they performed the tribute to Earth, Wind, and Fire. So I believe they played that presentation again, and got a lot of compliments, over at the County Office of Ed for it, and just want to compliment both of those programs on a job well done.
Ms. Ceballos?
Yeah, so also just want to start off by saying thank you to all of our staff, cabinet members, superintendent, because I know that they have been working very, very hard and diligently with, everything that is ahead of us with the reopening. So I just want to say thank you, and you are very, very much appreciated. I also want to kind of piggy off back what Mr. Tillman said in regards to the community day school. I'm not too aware of, I guess the background or the history of it. So I'd like to, kind of be brought up to date on it. I also, around that school, I also want some information around progress, right? What was the intention behind creating the school, and whether or not the intention has been met, over the period of time that it has been operating, right? Because I do also believe that there is benefit to the most or the least restrictive environment for students, right? And so we want to make sure that they are reintegrated with their peers and they have that same opportunity and possibility. And so that would be my take on it. Also, in terms of the funding, I know that we've been kind of discussing that quite a bit, and I do also agree and recognize that we do have the one-time funding. My view and my opinion on that is we definitely want to spend the money, for sure. We don't want to send any money back. But I also don't want to be throwing money at problems without accountability, right? We want to assess and evaluate where the need is, and we want to put money there, and we want to monitor for progress, because it has been, as a parent, I can tell you, before coming on the board, I would always hear that there was all this money, but on the floor where the services were actually needed, we never saw them as parents, right? So we want to make sure that we are providing money, but we're not just throwing money at problems without having that accountability to follow up with it, right? So I hope that we can do both of those things before the time expires, and we got to spend that money. I think that's it. Thank you.
Thank you, Mrs. Ceballos. Dr. Hill? Thank you, Dr. Hill. And so I agree. I passed by and I saw, I was like, wow, that's amazing. You know, especially if you've lived here, you know, your entire life, when you see those things, you're very proud to be a part of that. I just want to add a couple of things. First, I want to say Dr. Flores and I had the opportunity, and I know it was over 90 people on the call. I don't know exactly. I don't think they told us how many were teachers, but we had an opportunity to greet or welcome or speak to the teachers that are coming on staff. And it's really great. I mean, when you see out of all the things, you know, sometimes the negativity that goes around in the news and whatnot, but we have people that are coming here and excited about being here. And so it was quite a few, and we welcome them on behalf of the board. And so we're just looking forward to the new teachers that are coming, and I'm sure many of them are part of our Grow Our Own. I mean, I'm seeing more of that all the time. Either they've been here or they're in a mentoring program and they're giving back, because I talked to another group earlier today, and it was the same thing. We had students that had went to our middle schools that are back in mentoring. So that was great today. I want to say to Dr. Rodriguez, in one of the conversations that I had today in the community, they mentioned bring back 1,000. And I know you mentioned that's coming up again. I don't know what it's going to be called, but if it is that, what they did ask, some of the community said they would like to see them connected to the areas they serve, even to make it a little bit even more intimate, so that they know when they're knocking on the door of someone that may be familiar with a service that they provide, they feel that would enhance. And so I did say that I would bring that up to you. I also, this can go down in the notes because I'm not really sure, but I was asked two things. Parent Square, whether Parent Square and Aries is kind of merged together, and I've heard it, and I was kind of leaning towards yeah, but I said, you know what, we want to make sure that we get the clarity, and maybe it's going to be in part of some roadmap somewhere, because everybody's excited about being able to get that information, but they also wanted to know, is it going to be connected to Aries? The same group even shared with me that the lack of parents, because if you're been a parent in the district, when we came with Aries, we were so excited about Aries. I felt like I was a teacher way back then with my kids, because I can plug in and see what was going on. Now they're going to have access to other things. But the question was asked from me for someone that provided services, is it in Spanish? And I said, you know, I couldn't answer that question. Is Aries in Spanish? I'm assuming it is, but I don't know. And so they wanted to make sure that was happening if it wasn't, because they said sometimes our Spanish-speaking population they don't go on. And imagine your kid going on for you, who's going to give themselves up and say, go in here and see my grades. You know, so I did tell them I would share that with them as well. So Parent Square, they're looking forward to it because it's out. They're talking about it in the community. I also, in talking with Ms. Ceballos, who didn't bring it up, but I'm going to bring up additionally what I shared with her, is that we do, and I've shared this with the superintendent as well, we do want to know where we are. So I'm looking forward to the things that we would normally be looking at, you know, regardless of all these other wonderful things we're doing. We know that at the end of the day, it's math, it's English, it's language arts, and whether the numbers are shocking or whatever, we want to know that. And so not only knowing that here, I'm being told that perhaps we're going to get that the first meeting in August. Looking forward to that. But also, as I shared with Mr. Sellens, the budget too, because, you know, it seems to be the reoccurring conversation, right? So it's like a checkbook. We want to know, are we spending it? This time, we really want to know that the money is being spent. So having those check-ins, however they come, whether it's every other, you know, 3 months, 2 months, something, because we know down the road, 6 months, we're anticipating doing a lot of different things, but we need to know now where we are, and then we need to have temperature checks moving forward more regularly than not. I'm not looking to see 6 months later to say, we have a plan, we're setting goals, we're doing evaluations for the superintendent, but all of a sudden, we just now start talking about math, English, you know, and language arts. So I'm requesting that publicly, and we did share with that, you know, me and report cards. It tells you what you're doing. Everything is great to talk about it, but it's better to know what do you really have in your checkbook versus I had, you know. So that's my perspective on that, and however you guys can get back to us and let us know, that would be great, which is inclusive of the budget. And lastly, as I said, we do talk a lot about our special education too, but I hope that's inclusive, or we're looking forward to that being as a part of the plan and spending of money. because that is what we've already looked at as needing supports, as needing more boots on the ground, whatever you want to call it. We know that already that is a area of concern that don't often get talked about because it's looked upon as that's part of, you know, the system of what we do. But as we get more funding, that is a specific place that I would like to say, let's pay attention to that. So thank you so much. And now we're moving to 8.2, superintendent and staff.
That was a lot. Good. There was a lot of good stuff. But now on the data dashboard, so we will definitely come back in August. We're looking at either August 30th or I believe the 17th to possibly definitely provide a high-level overview of the data of where we are. Again, and you mentioned about shocking, and we know that the data is not who we are. The data is where we are right now, and we're okay. We're going to show that because the data is where we are, but that doesn't mean we're going to stay there. So we're going to be able to provide that, I believe, on August 3rd or the 17th. We are considering it for the retreat, but we're going to talk through that to see if that makes sense. But definitely either the 3rd or the 17th, we're going to give that high-level data dashboard exactly where we are, and then we're going to have conversations on what are our short-term goals. How do we want to move within the next 6 months or so, knowing that we still have to go on this listening and learning tour, we still have to do meet and greets, and we still have to get school up and running. So there's going to be a lot of things happening simultaneously, but we feel really confident that we'll be able to bring that information to the board, and that'll be something that we'll be working on in the next few days or so. But again, I think we're looking at August 3rd or the 17th, but again, I want to reiterate possibly the 31st, but I think because we want to do it publicly, we may lean toward the 3rd, because our retreat, we want to make sure that we leave time to get through those topics. So, and in terms of the special ed piece, I think that's important as we think about, and we've talked to this board about the service delivery model, as we think it through, we definitely, in those clusters, we definitely have to look at, I know Dr. Rodriguez and Dr. Menard has talked about, do we look at SPED support, SPED specialists? So there's a way within that service delivery model to provide the support around special education. I know because now that, you know, Dr. Rogers has brought that up, Mr. Sellens and Sandra, that idea that we talked about the SPED specialists in each of those clusters, we may have to go revisit that because that really was on the plan, but I think we were talking about it. So it'll work, but we still need time to determine what the model will look like because, again, we're trying to utilize the staff we have to build out the model. So we'll need a little bit more time, but we'll come back hopefully by August 3rd, no later than the 17th, ready to go. And some good news. I just want to talk about a couple of good things. I know terrible Terry Washington stole the thunder because it was on my list to recognize him today. So I want to recognize Terry again because he came and he showed up. That was great. But I also want to say that Sergeant John Gutierrez of our San Bernardino City Unified District Police Department has been named Officer of the Year. And I don't think he's here today, but I think we can give him a shout out. And also, the superintendent summer graduation ceremony, remember that's going to be held Thursday evening on the 22nd at 6 p.m. Way World Outreach Church. And if the board members can arrive by 5:30, if you're going, please reach out, let us know, let Karen know, let me know, and so on. And also our Administrative Leadership Institute, we're going to start that kickoff on July 26th. And really, the purpose this year and the purpose going forward of our Administrative Leadership Institute is really to focus on teaching and learning. How do we improve instruction across the district? We also, but this next week is you're going to be reviewing with our principals and our managers safety protocols. We're going to be looking at some of our instructional support systems, and we're going to be officially launching Parent Square because we want to make sure that the Parent Square is an opportunity for us to communicate exactly what we're doing and why we're doing what we're doing so everyone can be in the communication chain across the entire district and even publicly. And then our educators will be participating in 2 days of virtual professional development, and that'll be next week on the 27th and 28th. And the focus there is really to strengthen our social emotional learning practices. Again, as we prepare for the school year, we want to make sure that the SEL component, everyone is focused on that. because we want to start the year off right. We know our students have been out of school for a long time, and we want to make sure that social emotional piece, we hit it head on right away, but we're still going to also be focusing on instruction. So, yeah, I think that, again, we always ask that everyone be patient as we move forward. But again, we will definitely get back with the board on August 3rd, 17th, but the board retreat, I'm looking forward to it. I think that'll give us an opportunity to continue to calibrate as a board. And again, an opportunity for us to do some other activities. So I'm pretty much.
All right, thank you. We are now moving to 9.0, action items. 9.1, approval of personnel report number 2, dated July 2021, which contains actions such as hiring, retirements, resignations, promotions, and terminations.
As presented.
I'll move.
I didn't hear a second, but I did hear 2. Did you get it? Who's second?
Second.
Kind of like Danny.
Did you get it, Ms. Cunningham? Okay. All right, if there's no further discussion, let's prepare to vote. Thank you. And it's on our screen, so let's vote. All right, motion carried. 9.2, consideration and approval of the employment contract, Deputy Superintendent.
I have a, oh, go ahead.
So moved.
Second.
And moved in second. Is there any Yes.
Yes, I have a question. So I just wanted to clarify, and I want to say thank you, Dr. Funches, for reaching out to me. I had a couple of questions on this. So the $950 monthly housing allowance, and I know you kind of clarified that everyone has this. So all of the assistant superintendents has that allowance?
If they live in the San Bernardino City Unified School District boundaries.
If they live within the school district?
Correct.
Okay. All right. I just wanted to clarify that piece. All right. Thank you.
All right. Any other questions? All right. Thank you, Ms. Rosales Medina. We'll prepare to vote. Thank you, Dr. Hill. All right, it's unanimous. 9.3, consideration and approval of the employment contract, Assistant Superintendent, Equity, Access, and Innovation.
So moved.
Second.
And moved in second. Is there any discussion?
Yes, I have a question. So then, with the 187, and I did get clarification, just to be correct, this is the second tier, and the first tier is 178, I believe?
77. It is step 2.
Oh, this is tier 2. And so then when looking at his, I'm trying to frame it, experience, can you explain why he got the second tier versus the first tier?
So it's common practice to take into consideration a candidate's experience in higher level leadership positions. And Dr. Esquivel is a sitting superintendent of a district. He's run day-to-day operations of a school district as well. And he works closely with his current board. So in that light, in the common practice of taking a look at his experience coming in as an executive leader, the decision is made based on practice here to go ahead and provide the step 2 rather than the step 1.
Yes, okay, great. And then, so then, the cabinet that we have right now, they're all earning the second tier? Is there anyone that's, and you don't have to answer specifically, just curious to see if it's, I'm just looking at what we're hiring someone that, you know, for me personally, I looked at his record within this, being a superintendent. I think it was 2 years, and it was a small, very small school district. So adding him straight to the second tier is a little high for me personally, but I'll leave it at that. You don't have to answer the question because I know it may be somewhat of a conflict.
All right, is there any further questions? If not, we will go ahead and take the vote. Dr. Hill? Okay. All right, motion carried. All right, we are at 10.0 consent items. We know that
So
10.
moved.
Second.
Thank you. All right, at this point, 10.3 has been removed. And is there any others to pull?
10.20?
10.20. Is that it? All right, we'll go ahead and vote on all of them, except 10.20 and. Did you not get the second, you said? Oh.
Waiting for it, Karen. Hasn't popped up.
And 10.3, you had already removed, correct? Okay, all right, let us vote.
I had 10.20, which is the ratification of the agreement with the Hanover Research Council.
Hold on a second on the vote.
I'm sorry.
Myra. Did it pop up for you? Okay, I think we got. Okay, all right, we got everybody, motion carried. Now back to 10.20. Go ahead, Ms. Rosales Medina.
Yes, it's a ratification on the agreement with the Hanover Research Council, LLC, for $95,000, human resources. And so I was looking at the contract and just trying to clarify, what will they provide for the school district?
Thank you, Mrs. Medina. As you may know, Human Resources has embarked on a very ambitious plan to not only identify, but put into place parameters for seeking out, recruiting, hiring, and retaining educators of color. And so with that, Hanover Research is providing research opportunities for us, analyzing data for us, connecting us with exemplars from around the country to make sure that we can connect with them and see who's out in front in this, and also looking at what we're doing now and providing feedback for us. So they're in this project with us for the long term. As a matter of fact, right now they're analyzing data that we've provided for them from our parents, our scholars, and our educators around the teachers of color. So it's a very ambitious project, and we needed Hanover Research, who are experts in the field behind such, to give us that support and provide some.
All right, thank you. And so then in one of the sentences, it says they'll do interviews. It kind of explains exactly what you said, but it's limited to, not limited to certain services. So I'm curious with that amount of money, what that's specific for? Because then what I'm worried is that later on, we're going to get a ratification or an additional for a service that is not included within this contract. So I want to be clear what we're spending the money on, because it does have there that may include but not limited to, and so they add extra stuff that they're.
May include, so there may be other services that I can request from Hanover that are not specifically stated here. And so the contract, as we went over it with them, is very, very favorable to the district. Wouldn't bring back anything that would put us in any kind of compromising.
Okay. I appreciate that. Thank you.
So moved.
Second.
All right, it's been moved in second. There's no further discussion. We will go ahead and take the vote. Thank you. All right, motion carried. Thank you. 11.0, board member requests. 11.1, staff review of the items requested.
Good evening, board. So tonight I captured about 9 things that you asked us to follow up on, some of which were responded to during the presentation with the promise to bring back additional information. So the first was from Dr. Barbara Flores, who asked that we would get back to her on which organizations were number 1, 2, and 3 in the nation for energy conservation. I captured that one mostly so that we could celebrate that award again. So I really appreciate the opportunity to recognize our work there. Dr. Barbara Flores also asked if our lobbyists were advocating for an extension of the COVID quarantine salary relief. And Doc Irvin pledged that we would request this of our lobbyists. Dr. Flores asked if we might be able to prepare for vaccinations to children in our schools when they become available. And Dr. Menarez responded that we would be working with our partners to do that. Mr. Danny Tillman asked that we would consider allowing telecommuting for employees who must quarantine in order to allow them to preserve the 80 hours of government paid leave. And Dr. Funches pledged that we would review that and report back. Dr. Flores encouraged that we would review the temperature checking process or the temperature screening process at our schools in order to expedite entry into our campuses. And Dr. Funches also pledged to assess that where it's needed. Dr. Rogers asked that we would clarify the leave processes overall, and Dr. Funches pledged to bring information back on that one. Ms. Myra Ceballos asked if we would provide background, the intention of, and the outcomes of the Community Day School to make her more familiar with that campus and its purpose, and I know that we'll bring that back as well. Dr. Rogers asked then that we would request regular budget reports to keep track of our project on spending the resources that are available. And then she also asked about Parent Square and whether that was connected with Aries and provided translation into Spanish, and the answer to both of those questions is yes.
And also the updates, those updates that I'm requesting publicly is where we are when it comes to English, math, language arts, those assessments. We want those ongoing. I mean, we want to know pretty much the state of where we are. I just want to make sure we didn't forget that. And I did mention special education in that budget.
I will add those. Thank you so much.
Thank you. Okay. If that being, did you have something?
Oh, no, we'll respond in the Friday update with that information. Some of it, it may be a high-level overview, but we definitely will respond on where we are and where we're going.
And when it's coming.
When it's coming.
Okay, very good. 12.0, closing 12.1.
To adjourn?
All right, everyone. Thank you so much for being here tonight. Congratulations again to you, Mrs. Coker, and thank you for staying with us. And to our viewing audience, thank you again, and we will see you at our next board meeting. Thank you again, and God bless.